Hi, I'm Beulah Scott, occupational therapist, and we have Michael Horsley, who is a physical therapist, and we want to talk to you today about home exercise program. And the reason why we chose this topic is during the coronavirus, obviously there's social isolation. And with the social isolation, there's a tendency to have increased inactivity, and probably a lot of people are watching a lot more TV than they usually do. So we want to emphasize the importance of home exercise programs, whether you're our client and we've given you a home exercise program, or you with another provider and they've given you a home exercise program. It's still important, especially now during this time, for you to follow through with these exercises. And it was important before while you were performing physical therapy. It is just as important, if not so more important, during this time for the home exercise programs. And Michael's just going to talk about the home exercise program, when you need to be doing it, why it's important, and how you can incorporate it into your daily activities during this time. So Michael, give us some ideas on the home exercise program.
Okay, if you've ever had physical therapy, like she said, your therapist gave you things that he or she wanted you to do at home. Whether it was for neck pain, low back pain, arthritic pain, whether it was balance problems, walking problems, they gave you something that you should continue to do at home. The thing with pain related symptoms, whether it's low back pain, arthritic pain, is the lack of movement actually will make that worse in the long run. Normally when we are living in a normal time, when there's not coronavirus around, you're going out and doing things more. You're going grocery shopping more often. You're going out to dinner with friends. So you're a lot more active. And generally in that time, doing exercises one time a day, doing your home exercise program is enough to keep you flexible and strong. But during this time, when you're staying at home, you're binge watching shows on Netflix all day long, the lack of movement is going to make you, number one, weaker. It's going to reduce the flexibility of all the muscles and tendons and ligaments that need to keep moving. Arthritic joints are going to become more painful. So you need to do it more often during this time period. Right now, I'd recommend a minimum of twice a day going through all of your exercises, but I would even recommend more strongly to do it 3 times a day to get through all of the exercises. You don't have to do them all at one time. You don't have to, if they gave you 20 minutes or 30 minutes worth of exercises, you don't have to do it all in one sitting. You can break it up into 5-minute or 10-minute segments, and that way it's going to not feel like it's taking up your whole day just to do exercises. But another thing that I would like to recommend is walking. Get outside at least once a day. Take a little walk. If you can walk a mile, great. If you can only walk 1 house down and 1 house back, that's fine too. Whatever you can do to get out and walk is going to be great for keeping your strength and balance up.
And obviously, if you're walking and you're able to walk independently, great. If you require assistance for that, you continue to have that assistance, with you, and not to obviously go do it on your own if you are not safe with it. So it's important to still follow, your safe guidelines, whether it's performing the home exercise program, walking, or whatever those activities are. Also, a good tip that I give people is while you're watching TV, use that as an opportunity to do your home exercise program in between when the commercials come up. So that breaks up the exercises and it doesn't feel like you just probably doing them one after the other. So that's a good way to break them up. And like Michael said, the concern during this time is the increase in pain, probably decreased range of motion and strength for your post-surgical people that may have started with therapy but now had to stop due to the social isolation. It's extremely important to perform those exercises. And if you're having any difficulty, our clients, we can help you out with that. Just give us a call. and we will, go through the exercises with you. Or if you are having severe pain or also a dizziness and having extreme balance difficulties that may need immediate intervention, please give us a call at 751-6005. We'll make the time to come in and work with you to help alleviate that pain, at least so that we can keep you out of the hospital. So if you have any questions, as I said before, give us a call and we will try and help you with whatever it is. Provided that you are our client and we are very familiar with you. If you're not, you can contact your provider and see if they can help you with the home exercise programs if you're having difficulty with that. So thank you. We'll be coming weekly with different topics. Next week is dizziness and balance, and Michael's our certified vestibular therapist, and he's going to talk about the dizziness and balance and some key things that you need to do to keep safe during this time as well, with regards to if you have those issues. So thank you for taking the time to listen, and we will talk with you guys again next week.